in priority neighborhoods throughout the city at this point. Here at the Warden Woods Community Center, it's been fairly busy on and off throughout the day, but it is an opportunity for people in the parts of the city that wouldn't otherwise get a chance to get tested to do so as part of the city's outreach. It's now a door-to-door campaign, reaching out to residents in Toronto community housing in a variety of languages to get people out the door and to a COVID testing center.
We want to make sure that people can get tested. Getting tested is a good thing. And so what we've seen is that when you combine outreach with testing where people live, is the number of people who get tested increases.
The renewed effort by Toronto Public Health as part of its Equity Action Plan comes as new data reveals residents from the South Asian and Indo-Caribbean communities have an infection rate 3.8 times higher than the general population.
Evidence shows that racialized and immigrant communities are more likely to work in frontline and essential work, like healthcare and supportive services, putting them at higher risk for COVID-19.
In what's being called a wraparound outreach, people are also being told about services that are available should they have to isolate, like food hampers and prescription drugs being delivered to them if needed. But the efforts need to dive even deeper, according to healthcare professionals working within the racialized communities themselves.
When these approaches are undertaken, they need to be done through a cultural lens. So it's not enough to go door to door and tell someone that they have to do something. It's imperative to identify the nuance around what is keeping them from participating.
The South Asian COVID Task Force, a group of healthcare advocates, just helped open a new testing site in Brampton. Meanwhile, Toronto continues with its pop-up locations every week, including 13 clinics at community housing buildings before now, and more canvassing planned for the days ahead.
It's a matter of making that information accessible to people and making those resources accessible to people in a way that there's actually going to be uptake.
Now, once immunization becomes part of the equation, the claim is, Councillor Joe Cressy, the Board of Health Chair, says this is all part of the model that they are going to attempt to use to roll out vaccines as well.